Good afternoon, everyone. I hope you're having a wonderful Monday. My name is Tiffany Hellberg. I'm the Vice President for Community Health of South Florida of Communications, and I want to welcome each of you today to our webinar for Black History Month. Today you're in for a treat. I am confident you will come away armed with the knowledge needed to make important decisions about the COVID vaccine. Our team of physicians is going to talk to you about the history of testing vaccines on Blacks and why there's such a hesitancy among people of color to get vaccinated. I want to introduce you to our esteemed panel now. And the first person that I want to introduce you to is Dr. St. Anthony Amofa. Dr. St. Anthony Amofa is our Senior VP and Chief Medical Officer at Community Health of South Florida, CHI. He's also the Chief Academic Officer for the Brodus H. Hartley Jr. Teaching Health Center at CHI. As our medical officer, he's responsible for oversight and direction of the center's clinical programs and services, including primary and specialty services, pharmacy, laboratory, health information management, and radiology. He does a whole lot of things for this organization, and when the White House wants guidance on how to address disparities in healthcare of underserved minority populations, guess who it turns to? Dr. Amofa. He's gone to Washington, D.C. multiple times to serve as a subject expert in healthcare. I also want to introduce you to Dr. Elizabeth Philippe. Dr. Elizabeth Philippe is our Chief of Family Medicine here at CHI and the Associate Designated Institutional Official for the Teaching Health Center. She has served as the National Coordinator for the Haitian Ministry of Public Health's Maternal and Child Health Program, and she's also worked with the World Health Organization, Pan American Health Organization, on its immunization program. And up next, I want to introduce you to Dr. Edwin Bosa Osario. Dr. Edwin Bosa Osario is a faculty member in our Family Practice Program for the Teaching Health Center at CHI. He's board certified as a family physician by the American Board of Family Medicine, and he's joined Coconut Grove Health Center in 2013, and he is currently working out of our South Miami Health Center while we renovate our Coconut Grove Health Center. He's also previously served as the Chief Medical Officer of Clinical Affairs at the Jesse Trice Community Health Center. And up next, I would like to introduce you to Dr. Janelle White. She's an established physician, privileged to be part of our family medicine program at the Brodus H. Hartley Jr. Teaching Health Center at CHI. Dr. White received her medical degree from the University of West Indies, Mona campus in Jamaica, and she's gained extensive clinical experience treating a diverse patient population. So without further ado, I would like to hand it over to our panelist and our Chief Medical Officer, Dr. Mofa.
Okay, good afternoon. Thank you so much, Ms. Hellberg, for this invitation. We are truly excited to bring you this program. We wish to have a conversation with you with one ultimate goal in mind. And the goal is to get as many of you listening in today to become comfortable with receiving the COVID vaccine. And the question is, why is this so important to us in CHI? Well, let's remember COVID is real. 2.4 million deaths across the world, almost 500,000 in the US alone, and in just 1 year is absolutely no laughing matter. But as we know, COVID has had a disproportionate impact on us as Blacks and African Americans. We are 2 times more likely to die from COVID compared to whites and non-Hispanic persons. But the silver lining here is the fact that we now have effective vaccines. The problem, though, is that there appears to be significant vaccine hesitancy among Blacks, in spite of the disproportionate impact of COVID on us. That is the basis for this webinar. And I am excited to get to work with this very smart panel that represent physicians and educators. They're good at breaking things down and keeping it real. My task is simple, to just facilitate a discussion, a conversation. And we'll begin with some topical issues on COVID vaccine and then open up for questions at the end. Before we begin the panel discussions, though, we would like a quick audience poll, one that we will repeat at the end. We want to get a sense of how many of you at this point are comfortable getting the COVID vaccine. So can we please at this time administer the poll? And this will help tell us if we were able to make an impact at all on that. That's a simple yes, no, maybe. Do you feel comfortable getting the COVID-19 vaccine? I'll give you a minute to respond. Okay, well, this is good. It's good to see, to read. 85% of us say that we are comfortable getting the COVID-19 vaccine. Not bad at all. 8% said no, and 8% said maybe. So at the end of this webinar, we will have another poll, and we hope to see that the numbers will have gone up in those who want to get the vaccine, who are comfortable, and less people who are in the maybe category. Okay, so let's start off by just making sure that every one of our panel members have gotten the COVID vaccine. So let me ask the panel members if we can take the poll off. So doctors, can you please verify that you have received the COVID vaccine?
Yes.
Yes.
Yes, definitely.
Very good to hear that. And any regrets so far?
No.
Nope.
Well, that's good to hear. Well, let's start off with you, Dr. Boza. I'm glad you didn't have any regrets, but you know, different people have different stories and reasons for really going ahead with the vaccine. I would love to hear from you, and can you share with the audience what your reasons or what your story is? What made the decision to get the vaccine not as difficult for you as it probably is for several other people?
Well, that's kind of simple. Mostly is because what are the options? Either on the one hand, you have the vaccine and whatever problems that can happen, which are extremely minimal. And on the other hand, we have almost 500,000 people dead in this country from COVID. So it's kind of like pick your poison. What would you rather have? Would you rather take your chances with something that we know definitely kills, or with the vaccine that we know almost nobody dies from? So that's really where we are.
Okay, thank you for sharing your story. And I think, you know, we hear several different reasons why people went for the shot. I think that appears to be one of the most common. That was certainly how I decided to get the shot, and I'm glad that I did as well. Okay, so let's dive right into it. Several people have not felt the way you have, especially in the African American community. So Dr. Philippe, why would you say this decision has been so difficult for so many people? I think understanding that will certainly make sure that the rest of our discussion is quite relevant as we attempt to get more people to become more comfortable. What do you know? What can you share, Dr. Philippe?
Well, since the beginning of the making of the vaccine, we've heard a couple of misinformation and people have a lot of misconception about the vaccine itself. So if I can take the first 5 or 6 top, it will be the vaccine can affect a person's DNA. The vaccine has a microchip, so the government will be following you for the rest of your life. The vaccine can affect fertility, so you won't be able to have children, whether you're a male or you're a female. And the vaccine has a lot of side effects that can eventually kill you. And then before last, it's the perception that the vaccine, that there were shortcuts and the vaccine was made too quickly. But if we want also to go back in history, there is that study that they did about 40 years ago on treating African American for syphilis, and everybody remember the trauma that caused in that community when we refer to the Tuskegee study. And until that day, we do have some offspring of those participants that have sequelae. So all this combination of factors causing even mistrust in the government and in the public health system for African American.
Thank you for sharing that, Dr. Philippe. Yes, you make some very helpful points that would help guide us in the discussions I appreciate your sharing the story of Tuskegee. I think, especially as this is Black History Month, it's important that all of us remind ourselves of this very painful history of our past. And I think that, you know, as we grow and evolve, it's important that our children, our grandchildren hear about that story, and certainly what we have done or what the health system has done to prevent that from ever happening again. But I think that is certainly important. 600 Black men promised free medical treatment for syphilis by giving fake medicines to see how syphilis would evolve. It was really atrocious to say the least. So thank you for sharing that. And certainly, we have made several different changes to prevent something like this from happening, right? So why don't we talk about that for a second? Dr. White, can you share some of the things you think have happened to make this potential atrocity almost impossible in this country? Can you share that?
Sure. I'd just like to say, you know, what was done to those Black men was just unspeakable. And fortunately for us, since that has happened, there have been many laws and regulations that have been passed to prevent this kind of abuse from happening. One thing I'd like to mention in particular is something called an IRB, which is an institutional review board. So it's basically made up of a cross-section of different people from different backgrounds, which they assess each study and they make sure that each study is held to a high ethical standard. So if they don't agree with, you know, what is proposed in the study, they will not permit it to progress. And people who decide to go against their recommendation will, you know, of course, have to face stiff penalties.
Very good for sharing that. Yes, there are stories out there where we hear about researchers doing bad medicine who were held responsible through stiff penalties, jail time. And I think all of those certainly do make a difference. I think it's also important to share this other aspect of Black history and to remind us that unethical medical treatment is just one of the ways in which, you know, Blacks have this history that has made us suspicious of science. But another one is this failure to inform or get consent and to compensate. And the classic one, the best known example of this, that I sincerely believe, and I'm quite confident that the changes, Dr. White, you talked about should really prevent, is that of Henrietta Lacks, right? Some of you may be aware of this young lady who had cervical cancer, and it was found that her cells, okay, were able to multiply for a long time outside of her body. And unlike other human cells that would die, it enabled her cell line to be used for so many incredible, innovative studies since then, developing vaccines, and so on and so forth. But the painful story here that we think the audience must be aware of, again, we need to know our history, is the fact that Henrietta or her family was really never compensated for the fact that her cells became the foundation for a multi-billion-dollar industry. But again, I think listening to you, Dr. White, I'm reassured that several of these things can never happen again. And the country has come up with several different ways to get around it. One of the ones I'm excited about was learning about the fact that one of the vaccines, the Moderna one, had a Black scientist engaged in its development, Ms. Kismakia Corbett, a fellow and research scientist at the National Institute of Health. Yes, that's the picture there. I'm glad. And that, for example, gives us a sense of confidence that, okay, Blacks were involved in developing these vaccines. Hopefully, unexpectedly, they would be making sure that if it was not going to be appropriate for their kind, right, they would certainly voice that. It's also good to know that the first person to receive the COVID vaccine, and she opted for this, she decided she wanted to get this, is Sandra Lindsay, right? She is a nurse and director of patient services at the Long Island Jewish Medical Center. And she said, you know, I trust science. She said, what I don't trust is getting COVID-19 because I don't know how it will affect me and the people around me. Dr. White, you said you actually knew Sandra Lindsay, is that correct?
Oh, yes, I do. She's a very, very nice person.
Wonderful, wonderful. Well, that's your claim to fame, and I hope you'll get
And
to
she's
meet her.
Jamaican.
Okay. That she opted to be one of the first is really very, very good, very powerful. All right, let's keep going on. And one of the reasons for vaccine hesitancy expressed in our Black community and elsewhere is a perception that the vaccines were developed too quickly. Dr. Boza, would you mind shedding some light on this concern? Is it a legit concern? Should people opt out of the vaccines because of this?
Oh yeah, so this is truly a major concern for most of all of us. That is for sure. There is typically a long, drawn-out process for vaccine development, and it seemed like the development of these vaccines was a little sooner than we expected. But typically, it takes years for the vaccine to be developed from scratch. What folks may not realize, however, is that technology for this type of vaccine that was developed, it started several years ago. And it was definitely shown to be successful, kind of a novel way of developing a vaccine. But adapting the concept to these vaccines did not have to take too long. Additionally, the entire world banded together with significant funding from the best science brains to attack this problem, and it had a potential to disrupt our existence for years. So because we know how bad COVID has been, the pandemic, we've never seen, for those of us that have been around, we've seen many problems, but this has been unique. The whole world was basically shut down because of this vaccine, but the development of this vaccine was extremely significant. It's also interesting to see that the production and distribution systems, because of how governments guaranteed the funding, could be developed at the same time as the vaccines were being tested. Because companies knew that money was coming in for the development of this vaccine, things got revved up a lot quicker and a lot sooner than they would have otherwise. And as typically they take long because companies usually want to guarantee funding before they start investing in the production. So yes, it was developed quickly for all of those reasons, but not really shortcuts on the safety issue. They were really done right.
Excellent. Thank you for shedding light on that. We really want to bust this myth. And I think the interesting thing about the mRNA COVID vaccines is the fact that they can be adapted very quickly as these variants show up. And the manufacturers already begin to do that. The ability to adapt the mRNA vaccine to a new variant is pretty incredible and novel. And so certainly would mean then that subsequent vaccines or vaccines for the variants will be developed very quickly as well. Okay, so let's talk about other reasons Dr. Philippe talked about as reasons why we've been hesitant getting the vaccine. Dr. Philippe, you talked about side effects and reactions to the vaccine. We've heard so many stories, a nurse who passed out, a doctor who died. Is the COVID vaccine safe? What are some of those side effects and reactions? Should we be concerned? Do you want to share that with the audience?
Of course, yes, the COVID vaccine is safe. Unfortunately, we had a few people that had side effects that were considered major, and those side effects are under investigation, and we're not even sure if they were related to the vaccine. When you consider that over 30 million people have been immunized, and when you put that into proportion, 1 in 50 million, 1 in 60 million, so the side effects reported have been very minor. And then those are the ones that we usually have with like a fever. You can have some muscle ache. You can have pain at the site of the injection. A small lymph node that you can have on the safe side of the injection. And those usually last a few days. Myself, I received the vaccine 2 weeks ago. I got my second dose. And after the second dose, I just had a day and a half of fatigue, loss of appetite, and after that, I was back to my usual self, if I can say, and able to go back to work and function until that day. So my husband received it, he didn't have anything. So side effects are there, like any other vaccine, and the vaccine is highly recommended and it's safe.
Well, thank you. And Dr. Philippe, if you can complete the thinking here as well, and there's a question that has come up with several of our patients. I'd like to get your take on that for the audience. Why do some people get side effects and some don't? You mentioned you did, your husband did not. Can you care to clarify that for our audience that's asking the same question as well? Dr. Philippe?
Yes, I'm here. So you're talking about why is it different in different people?
Right. Why do some people have side effects and why some don't?
So again, it's your make. It's the genetic factor of it. It's different people have a different reaction. You can have people that don't have anything at all, where you can have people that have very significant side effect. And then also people need to understand that when you get a vaccine, the way your immune response react, is part of it. So the more your body react to what is injected and then the making of the antibody, the more you might have side effects. So it's something that happen, and it varies between anybody. And I'm sure among all four of us, we can see that there was a different side of side effects, correct?
Yes, I think I was just privileged. I just had the local injection site pain. But you're right, genetic makeup, the strength of our immune systems, the current comorbidities like hypertension, diabetes, and all those things we have, they really do make the difference. Which reminds me of another of the reasons for hesitancy you mentioned. So Dr. White, perhaps clarify this for our audience. Is it true that the Pfizer and Moderna vaccines can affect our DNA?
I'm glad you asked this question because I've gotten it quite a bit from a few patients. So no, the Pfizer and Moderna vaccines, they cannot affect our DNA. They don't interact with our DNA at all. If I even had the inkling that this would affect my DNA, I definitely would not have gotten it. So I would just like to, take us back a little bit with some biology. Each cell has something called a nucleus, which is where our DNA, which is our genetic makeup, that's where it's house, that's its safe place. The COVID vaccines, the Pfizer and Moderna, are what we call mRNA vaccines. So they basically, encourage the body to make proteins that promote the production of antibodies against the COVID virus, so that when we do become exposed, we're less likely to suffer a severe illness. So again, no, it will not affect your DNA. You'll be fine.
Very good. Thank you. So the DNAs are safe. Excellent, excellent. I think we'll discuss also, if we can, or maybe I'll go ahead and share that. There have been concerns about the potential, or some patients who said they want to wait before they get, they have babies, get pregnant because of the effect on DNA. At least that question is answered. It can affect DNA. We'll answer a few more questions and then open it up to the audience. And depending on the questions that come in, I might come back to the panel for further discussions and questions. But Dr. Boza, tell us very quickly, can you develop COVID after receiving the vaccine? That has also been a reason for people being hesitant. Can you clarify that for the group?
Absolutely, a great question. No, you can't, because it is not using any virus to be developed. There is no virus in the COVID vaccine. It is kind of a man-made component that is there to kind of trick your immune system into believing that it is the actual virus, and that's how your immune system revs up, because we got the vaccine. But there is absolutely no issue with your acquiring COVID from it. Now, it will not prevent you necessarily from getting infected from COVID. You just won't get sick from it. There's the jury is still out as to how much will you be able to infect others. We don't have the right answer for that at this moment. There is the possibility that you can infect others while you're still not sick. You could carry potentially the virus and give it to others, but the replication of the virus, in other words, when you get infected, the virus does not reproduce itself in you when you've had the vaccine. So the jury is still out. Always best to be using a mask after the vaccine until most people are vaccinated. That is the general recommendation. But absolutely, no, you cannot, you will not get COVID if you get the vaccine.
Very good. That's very important. So, several people thought or of our patients have felt that the vaccine may contain the COVID virus, and so when you get the shot of the COVID vaccine, you can have COVID. And thank you for clarifying that. And also, let me underscore what Dr. Boza just said, which is that we know at this point that you may still infect others if you've had the vaccine and get infected yourself. The risk is certainly low, but it's not zero. And so the need to utilize other safety precautions remain important. All right, one other question that comes up is, if it's flu season, right? And I want to get a flu shot and a COVID shot. Dr. White, can you clarify that? Can someone receive the flu vaccine and the COVID vaccine at the same time during this flu season?
Okay, that's also a really good question. I'm glad you asked it, Dr. Mofa. So it's recommended that we do not administer the COVID and the flu vaccine at the same patient visit. We should actually space it out about 14 days. But I know it's COVID time, but I also don't want people to forget about their flu shots.
Very good, very good. And so I think, take home message there is that if you're not due to receiving the COVID vaccine within the next few weeks, go ahead and get a flu shot. The value is significant in several different ways, including making sure that if you have flu-like symptoms, we less likely confuse that with COVID. Excellent. Another common question: I'm allergic to latex or eggs. Can I receive the COVID vaccine? Dr. Boza, can you shed some light on that for us?
Absolutely, you can. There is no, so the vaccine vials have a little rubber stopper in it, where they introduce the needle to get to the vaccine. And some people who have very extreme allergies to latex could be worried that this could be a problem. There is no such latex in the rubber stopper. The vaccine does not use eggs for its development. So the answer is yes, you can get the vaccine, because even if you have allergies to latex or eggs.
Wonderful, excellent. So that should not be a reason for vaccine hesitancy. Thank you so much for sharing that. All right, let's do maybe one last question, and we'll open up to the audience for questions, and we can come back to additional questions that we want to explore. Dr. Philippe, perhaps you can clarify this for us. Can children receive the COVID vaccine? Can you receive the COVID vaccine if you're pregnant or breastfeeding? What is out there right now? What is the current position?
Okay, when it comes to children, if you are 16 and above, you can receive the Pfizer vaccine. And if you are 18 and above, you can receive the Moderna. So this is something that's out there and that's recommended. As far as pregnant women, the data is still not there. However, it's off the press this morning coming to NPR. I heard that there was one pregnant woman who is a healthcare worker who was immunized today. So, and she was sharing the experience. So it will come it will come probably sooner than we expected, that pregnant women can receive the vaccine. So this is a conversation for the patient to have with their provider and see where we are at with the current recommendation for pregnant women and also for breastfeeding women. But breastfeeding women, it should not be a problem either.
Thank you for sharing that. That has come up quite a lot. I think it's reassuring to hear that the manufacturers have begun enrolling children into vaccine trials to make sure they can get us some data quickly, because children certainly present another opportunity to transmit the virus significantly, and hopefully it should be safe and it should be effective in kids as well. Thank you for sharing that. All right, so we're going to ask the audience to please type in your questions into the chat, and we'll try to take them as quickly and as many as come up. And so again, if you have a question to ask, please go ahead and type it into the chat, and we'll be able to answer them as we go along. All right, while we're waiting to see some questions from the audience, certainly a few more questions that we can answer, and certainly some questions that have come up that we think will be helpful for folks to be aware of. All right, so let's keep going. One of the common ones, I actually had the patient of mine ask me over the weekend, and the person's concern was about, the Pfizer or the Moderna vaccine. Is one of them better? Should I wait for one, especially if that one is not available? Okay, so Dr. White, can you discuss that with us? Is one of them better than the other?
A good point to bring up. Thank you. So actually, our research shows that they are actually quite similar in effectiveness. Both are around 95% effective, meaning 95 out of 100 people who get the COVID vaccine will be protected against a serious illness from coronavirus. So as I agree with what Dr. Bosa said earlier, COVID, so many people are dying. At this point, I would just take whichever vaccine I could get.
Excellent, excellent. And Dr. White, again, do you think that there's any difference between these mRNA vaccines and the traditional vaccines? Are those traditional vaccines safer than these available mRNA Pfizer and Moderna vaccines, would you say? Dr. White?
So I think it's a little bit difficult to compare our traditional vaccines to these newer type of mRNA vaccines. We still have, data that's coming in because it's new. So but at the end of the day, the mRNA vaccines are safe, and that's what we need to focus on.
Excellent, excellent. Great, great summary there for us. Okay, so we've all alluded to and asked and heard about, and Dr. Bosa, I know you are one of our local experts in CHI on immune compromised HIV patient management. Can you talk about that? What about patients with HIV, patients with compromised immune systems, patients who had chemotherapy or radiation transplants? Should they receive the vaccine, would you say?
So this is a conversation that has to be made with the provider, with the specialists involved in the care of these patients. But we go back to the same problem as before. You have the vaccine on the one end, and then you have COVID on the other. The more problems that you have, the more pre-existing conditions that you line up in your own self, the more the chances that you're going to wind up in a nasty group with serious side effects, serious problems from the virus, or even dying. So as far as I am concerned, because the vaccine has been proven safe, I have no issues in recommending those that have immune compromised status to getting the vaccine. Because again, what is the option? Taking your chances with COVID? I don't think so. COVID is really damning, and it's shown everywhere that it is. Maybe there is a possibility that if your immune system is not strong enough because of medicines that you're taking or conditions that you have, that you may not mount the same defense or that a person who is immunocompetent would. There may be a possibility, but that's still better than not getting any vaccine. So some protection is better than no protection. And I always advocate for getting the vaccine.
Very good. Thank you. Thank you for sharing that. I think you summarized it quite well in terms of what we want our patients to hear about. I think an offshoot to that is for you, Dr. Philippe. Can you receive the vaccine if you've had COVID, right? What does the jury say on this one?
So good question, Dr. Mopa. It comes up a lot. Yes, you can receive the vaccine after you have had COVID, because first of all, you don't know how long the immune system will cover you and how long of a protection you may have. So therefore, it's recommended that you can wait up to 45 days after you've been with COVID to receive the vaccine. And there's no harm to do that.
Very good. Okay. So that should not be a reason for vaccine hesitancy, and we hear that as well. So Dr. White, how long does this immunity last? What are our experts saying on that one right now? What should the audience know?
So in terms of how long the actual immunity from the coronavirus vaccines, we're not exactly sure, But we do know that your maximum immunity or your maximum protection, we get it after 14 days after getting your second dose.
Okay, very good. And you're right. I think that the vaccines continue to be studied, and with the new variants coming out, what the thinking is that there's a strong possibility that there will be a need for booster shots, as we have with the flu shot, with vaccines like COVID that keep mutating and switching and changing. But I'm rest assured on the fact that these mRNA vaccines can be adapted to new variants very quickly. And so, with the immunity is waning because there's several variants shooting up or coming up because not enough of us have gotten, the initial vaccines. We should be able to turn it around and hopefully push further out the immunity that many of us will then have. Perhaps, Dr. White, you can also clarify. So, people ask the question, why should I still use a mask after vaccination if the vaccines are so effective? Can I start using the mask?
Oh dear, yes. So again, I'll first like to say the only reason I don't have on a mask right now is because I'm in a room closed by myself. So, the COVID vaccine, the mask is obviously your first layer of protection. The second is your COVID vaccine. So even though, like what Dr. Bosa said, even though you get the vaccine, you can still become infected with coronavirus. So you need to do everything that you can do to protect yourself.
Excellent, excellent. Okay, we'll ask one last question and then we'll begin to wrap it up. And this is for you, Dr. Bosa, as the techie nerdy person in this group. Does the vaccine have a microchip? Can that be used to track us?
Only if you believe that sci-fi movies are real. Because the reality is that there is no such thing. I mean, there are people that get very concerned about it. There is no such thing as a chip or microchip that it gets introduced when you get the vaccine. Absolutely not. So absolutely, that's a myth that needs to be debunked.
Well, thank you for sharing that. In a similar webinar we did over the weekend, one of the panel members said something I thought was so creative and so educational. He said, we're worried about there being a chip in the COVID vaccine, but we're paying for us to be tracked on our cell phones, right? We pay for these cell phone services that include significant tracking of whatever we do, wherever we go. And that probably should be what we should be worried about first. I thought that was a very good point. Okay, so I think we've covered a lot of great topics on vaccine hesitancy in Blacks, and perhaps we have made a difference in the life of some of the members of our audience. Before we wrap it up, we would love to find out from the audience post-webinar poll to see if perhaps there's a change in the number of people who are comfortable getting the vaccine. And then I'm going to ask each of our panel members to make some closing comments and then hand off back to Ms. Helberg to make the final closing comment. So can we put out the poll again and let's see what people are thinking right now. Give me 30 more seconds and we'll close the poll. Wow, this is very interesting. So, we at the beginning of the session, and I have to say, we certainly just had a few people on there at the time. We had a significant proportion of folks who said they want to get a vaccine. At this point, we still have 28% in the maybe area. And we certainly hope those of you on the fence there, if you want to talk to one of us in CHI, we certainly have Dr. Bosa, Philippe, Dr. White. They know this stuff. They can break it down for you. Tiffany, at the end, will share with you how you can reach us. how we can help answer the concern for you. We want to make sure that there's no one in the maybe zone with the knowledge we think we can share with you. All right, so we've discussed a lot. It's time for us to ask each of the panel members to make a closing comment, perhaps a phrase or two that you want people to take away as a take-home message. So, Dr. Boza, we want to go first. What is your take-home message for the audience?
Absolutely, the vaccinate. It is critical. We're in a situation where we weren't many years ago. For many years, we haven't been in this circumstance. Vaccination saves lives.
Very good. Well said, short and sweet. Hopefully this will make an impression on people's minds, especially those in the maybe area. Dr. Philippe, what would be a closing comment from you?
The vaccine is safe. Myself, I took it, and I'm very proud to be part of the solution to help control that pandemic. So I truly encourage everybody to just go for it. It's better to have some muscle ache than to get COVID and then end up in the ICU.
Very well said. Very well said. Okay, Dr. White, any take-home words of wisdom?
In addition to what was said, I just want to say, at the end of the day, the purpose of this was just to get everyone together so that we can all be informed and educated. And at the end of the day, you have to make the right decision for you, which I do think is getting the vaccine, but no one will force you. It's your choice. We just want to give you the tools to be able to make an informed decision.
Again, very well said. I am so privileged to work with these very wise clinicians who really have a passion for the COVID and COVID vaccine, and I'm grateful to be on this panel to have this dialogue. My closing comment, remember COVID is real, and please, please do not become a COVID death statistic. With that, I'm going to hand off back to Ms. Hellberg. Thank you, Ms. Hellberg and team, for inviting us, and we hope we're able to answer as many questions on the time allowed. Thank you.
Thank you, doctors. You guys did a great job of breaking down our history as well as telling us why this COVID vaccine is so critical as we move forward and hopefully out of this pandemic soon. So I want to tell you a little bit about CHI has been here for the community from the beginning of this. In fact, we were the first to offer drive-through COVID testing in both Miami-Dade and Monroe counties. That's a picture of one of our nurses as we were selected of one of just 50 photos nationwide in Newsweek. We're super, super proud of our medical team for stepping out there when the community needed us most. Then I also want to tell you about CHI's rich history in Black history. That woman on the left there is Doris Eisen. She's our founder. She's a Bahamian woman who couldn't stand to see people dying en route to Jackson Memorial Hospital back in the early 70s and late 60s. That's because the local hospitals back then wouldn't accept people of color. So they were dying trying to get medical care. And she said, enough is enough. And she got volunteer doctors to work out of 2 double-wide trailers that you see on the right there. And from that, we've evolved into what we are today with 11 health centers and 35 school-based centers offering comprehensive care to the community. We are offering all sorts of COVID testing options now. We offer the PCR test, the rapid test, the antibody test, and of course, we have received a small amount of vaccinations. We have vaccinated our frontline staff and also started to vaccinate some of our elderly patients. And we hope that as the vaccines become more available, we can open it up to the general population. So please make sure you sign up for our newsletter on our website so that you can get word when we do receive those vaccinations. We also, as I mentioned, offered comprehensive care here at Community Health of South Florida, from primary care, pediatrics, dental, vision, OBGYN services, pharmacy. We will deliver your medications for free to your home, radiology services, urgent care, behavioral health, and also telehealth. We launched comprehensive telehealth services during the pandemic. So please make sure you make your appointments. We've been here. We've never closed our doors throughout this time, as we want to make sure that everybody has access to high quality health care. We're here. We take in most insurances, and we also offer care to the uninsured based on a sliding fee income-based scale. Again, please Partner with us here at Community Health of South Florida. Make us your medical home. We're so proud that you joined us for today's webinar. We are going to be putting this on our website and on our social media platforms. So if you tuned in late or you want to share it with family and friends, please do. Thanks again and have a wonderful rest of your day.
Thank you.
Thank you.
Thank you.
All right, so we're